Hi, good morning, everyone. Thank you so much for putting your name and location in the chat and letting us know what you are looking forward to learning in our time together this morning. So we are so glad that you are here to join us for the next in our series for our HEART Ambassador Training, which is part of our New England MHTTC School Mental Health Initiative. Our goal is to help schools cultivate compassionate school communities that buffer against the negative effects of trauma, help build resilience for all students and all members of your school community, and hopefully help those of you who are educators and working in schools find some stress relief and support during this very challenging time for schools and educators. So again, welcome. And if you are joining us for the first time today, this is part of our HEART Collective HEART Ambassador Training. Our HEART Collective is supported by the MHTTC, but is also in partnership with our other regional centers, the New England Addiction TTC and the New England Prevention TTC, as well as our partners at SAMHSA and HRSA. So this is really a region-wide collaboration. And we welcome those of you who are outside of our region. Welcome to this training. This is the fourth in our series, third in the series, sorry. And we have a couple more sessions, so we hope you'll join us for the next couple of months. And our goal with the HEART Collective is to help build and support collaborations between school communities and community health providers. Our goal in all of this work is to help create compassionate school communities. And what does that mean? Just in the simplest terms, we're talking about helping school communities understand the neurobiology of trauma and stress, understand the benefits of using mindfulness approach to transformational leadership, think about how we can build and support community collaborations for all aspects of our school communities, and to help engage and work with other community stakeholders within our school communities and beyond, from families, students, staff, community-based organizations, health providers. If you're just joining us, thank you so much for putting your name and location and what you're hoping to learn today in the chat. This is really great. I see people looking for ways to connect and build relationships, interested in supporting parents and caregivers and advocating. This is terrific, and we hope that you will learn more about engaging all members of our communities in this really important work, because it takes all of us working together. So with that, I'm going to just start with some framing and context for why we are having this discussion today and some of the challenges and ideas that we can take through this conversation today. If you have questions, comments, please put them in the chat and we will try to answer them as we go along. But we also have question and answer time at the end of the presentation, and we are open for office hours after this presentation. If you have questions, concerns, challenges, or successes that you want to share and get some consultation on, or hear from other people in your who might be in your situation, might be able to learn from you. So again, please put your questions in the chat. And I want to just start off with thinking about some of the possible challenges when we're working with our stakeholders. Many of these you're probably already familiar with, but I want to sort of set it up this way because our speakers today are going to offer some resources for meeting these challenges, some initiatives that they are offering or that they have worked on in their own work that possibly can help you. And we're presenting a lot of information today. Don't worry, you're going to get the slides at the end, but we will also be offering some shorter one-page tip sheets that really distills this information for you. So don't worry if you're not getting all of this right now. This is really to introduce some ideas and hopefully give you some food for thought about ways that you can increase stakeholder engagement in your own communities. So what are the possible challenges when we're working with our stakeholders? Well, it depends on your perspective, what part of the system you are working on or working in, and what your role is in those systems. So sometimes schools and educators don't recognize how important parents and families are for our school mental health initiatives. We may not understand the families in our school communities, what their cultures are, their languages, traumas, their values. Sometimes educators in schools aren't trained to connect to families or students about mental health, or they don't feel confident. We don't feel confident sometimes talking about these things because these are new ideas and new roles that schools are taking up, particularly now. But often one of the biggest challenges that we face from a school and educator perspective is that we feel overwhelmed with the amount that we have to do, with the issues that we're seeing in our schools and classrooms, with our own well-being and our own stress. So what are the challenges from the students and families perspective? Sometimes students and families don't know how to support mental health at home. That may not be part of the language that students and families use. It may not be part of their own cultures to talk about these things. So we're beginning from that place of understanding that not everybody is familiar with these issues and how we might be able to support each other. Sometimes students and families are experiencing challenges. We may know about some of them, but some of them may be not as obvious, and we may not know about them, but it's important to remember that families and students are coping with a variety of challenges like illness, violence, substance misuse, other stresses, financial stress. Sometimes families and students have school or system-related losses or trauma that we need to be aware of. Not everybody, not all families and students necessarily see schools as partners, and we have an opportunity to demonstrate our willingness to collaborate in a compassionate way through our work. And sometimes students and families are also overwhelmed. The things that schools and educators are coping with, families and students are as well. So knowing what these challenges are, what are the solutions? What are our steps to move forward? The solution is to begin building relationships. And our idea is to begin building those relationships before an issue arises, because then we have that foundation from which to offer guidance, support, resources. So how can schools begin engaging with families? Building consistency, learning about who your families are in your school community. Again, what their values are, what their cultures are, what languages they speak. Finding ways to share the school mental health or SEL programming or initiatives that you're working on within your schools. And that can be having a resource center designated, having a specific point person that that families can contact and begin building that collaboration. But a lot of it is about inviting families to identify what their goals are, what their resources are. And invite families into this process and invite students into this process. So how can families engage with schools? If you're a parent, a grandparent, a guardian, a family member, how do you begin to build those relationships? It's about getting to know your child's school team. Who's in the team? Who is your child interacting with every day? It's about reaching out for school supports, to ask questions, share your observations. It's reaching out to the school in a way that makes clear that you want to collaborate because you're all invested in your child's well-being. It's helpful to focus on solutions and strategies, and to know that you have the right to ask questions and to get answers and to follow up as many times as you need and feel are necessary. And you can enlist help in this process. And Stacy and Dana today are going to tell you about some of the ways that you can do that, either from the school perspective or from families' perspectives. And how can we begin to engage with students? The first thing to remember is to be authentically curious about about students' lived experience. What are their perspectives? What are the experiences that they're having? What are the questions that they're having? And when you ask these questions, you then have to listen closely, hear your students out, reflect back what you're hearing. And from that place, you can begin to offer some guidance, let students know about the available resources, reiterate your support. You can model how to talk about mental health and how to do that without stigma. You can provide examples of other students or other folks in your content area, say, that have experienced these kinds of challenges and how they dealt with them. But most importantly, it's important to affirm for students that you know that their perspective is valuable. They're the experts on what it's like to be a kid in schools today. So that is a quick round of some concrete thoughts for how to begin and build these relationships. Again, you will have all of these in a resource to look at, but I just encourage you to think about these kinds of ways that you can take small actions to build the relationships as we move into our presentations from Stacy Champey and Dana Asby. So with that, I am going to pass it to Stacy to talk about her work. And again, I encourage you to, if you're just joining us, put your name and location in the chat, what you're hoping to learn today, and please let us know if you have any questions. Okay, Stacy.
Thank you, Martha. Hi, everyone. Thanks for joining us today. I am a district multi-tiered system of support, behavioral health and wellness framework coach. That's a long title. I work in the Manchester School District in New Hampshire. And what I do is I work on the systems and practices from our district level to support student behavioral health and wellness. That includes positive behavior supports, social emotional learning, mental health literacy, trauma-informed schools, relationships, and staff well-being. So there's a lot of pieces to this work that I do. Next slide, please. So I'm going to focus on one part of the systems and practices today, and that will be on comprehensive school mental health through the lens of trauma-informed schools. I think we can all agree, I know everyone's in different roles here, but the need for school-based behavioral health is great. Only 12% of youth with mental health concerns receive treatment, and students need support to have healthy social, emotional, and executive functioning in school to be successful in school and ready to learn. Schools are a place where, on next slide, please, 70 to 80% of youth can receive mental health services in school. And without those supports, they're at greater risk for substance use, violence, more severe mental health challenges. So it is important in the work that I do and in the work that some of you do, or if you're able to advocate, to set up a framework in our schools and districts to support student behavioral health. Next slide. So one thing that you can do to start is gather your stakeholders together. If you're at district level, you can establish a district team, which would be comprised of district level leaders. Many people are working on the same initiatives or working in silos. So bringing everybody together at the table to collaborate is important. Bringing in your community leaders around children's behavioral health, bring school administration and teaching staff to the table, and family and youth voice is very important. If you're at school level, you can still do this work by gathering a team and bringing together families, school administration, community partners that are working in the school. You want teachers' perspective, and again, families, student voice, and representation of various stakeholders to bring to the table to work on this framework. One piece that I found very helpful was to first talk about the why. Why do we need this in our schools? Why do we need this in our district? There is a TED Talk here that I provided a link to. For the sake of time, I'll leave it on there for you to refer to after. But there, it talks about, little summary, how increasing number of students deal with adversity outside of school, and they bring this into the classroom. And these students, the very things that they need with this toxic stress that they're dealing with, all students benefit from. And we have the opportunity in our schools and districts to provide a stable, nurturing environment for these students, for all students. First and foremost, for that strong foundation with relationships and positive behavior supports and mental health practices that begin at that foundational level to support all students. So this talk is a wonderful way to start those conversations. And as she addresses the needs for this type of an school environment and framework. And if you were to go a little deeper in your conversations and you're in a position where you're able to look at school and district data around discipline and office referrals, we're finding high rates of this in schools that are in need of school-wide mental health supports. If you're able to do that, that adds to the conversation with stakeholders to say, yes, we are identifying, even based on data, that this is a need and we need to do something about this. This is a framework based on the Missouri model. Often we talk about trauma-informed, and you may be in a district where you've done trainings that are trauma-aware trainings, where you're talking about the signs and symptoms of trauma, and that is the foundational piece that is important to do. But the framework moves on to trauma sensitive. Do we have this systemic training for all staff every year? Are we trauma responsive? Do we apply the knowledge of trauma and resilience, and our staff using specific language in the classrooms? And are we using trauma-informed and healing-centered practices? Do they know how to respond to students in certain situations? So there's a continuum with this framework to consider when you're bringing stakeholders to the table and looking at your school or district and where you are and where you would like to head. There's several pieces to the work that I do that looks at systems and then your practices and then how you're going to evaluate what you do. This assessment, the Trauma Responsive Schools Implementation Assessment, and I noted down below who is part of this assessment and collaborated on this research. This is a wonderful assessment to get a baseline of where your district is as far as being trauma responsive. The areas on the left: safety planning, prevention planning, trauma programming, classroom strategies, and so on, are modules in the survey. Wonderful if you are able to gather people together and you're at a district to use this for planning, as this tool does talk a lot about systems and it is policy driven. But you can do this at the school level, and you can use this to plan around what you are able to do in your school and advocate for what you may need at the district level around being a trauma responsive school. Or if you're in the community, use this to gather stakeholders together and talk to a school or a district about, can we gather a group of people to collaborate and work on this to see where we need to move next. So again, for districts, if you're able to do this at the district level, one of the first things that I worked on was mapping out what's happening already district-wide. There's a lot of good things happening around the district, depending on the size of your district, and you want to know what's already happening. And then again, look at this assessment, if you're able to do this, and use it as a planning tool. Where can we align with work that's already being done? Where can we align with our community partners and come up with an action plan? Often there's many areas that we can address when we're doing these action planning tools and assessments, but pick a few things to tackle and work on those, and then evaluate. Are we doing what we said we were going to do? What data are we using to see if we're making progress, and where do we need to shift with our planning? And this is something you would do annually. If you're in a school, pretty much the same idea again. Map out what initiatives are happening, but at the school level, conduct this assessment, and then choose items to plan around. Again, advocate at your district level where you would like some more support, policies, and align with community partners, and same thing, action planning and evaluate what you're doing. I have a link to this assessment at the end. So this trauma framework, again, maybe you have already offered annual trainings around trauma aware and how it impacts students learning in the classroom. And you have those systemic trainings already built in around being trauma sensitive. Maybe you're at a point where you're looking at trauma responsive. There is a link here to Philadelphia ACE Task Force that I don't know if you're able to click on that and bring it up, Martha, or if that's going to mess us up. This is a great document. If you scroll down, you can see that it starts at the trauma aware section of the framework, and it goes through each section. It'll say, what do you need to do to plan this? Where does it show? Have you already arrived? Do you need resources for planning? So it goes through each section of that framework: trauma aware, trauma sensitive, and then further down, if you're at trauma responsive. This is a great little tool for planning if you're really into those systems pieces and you're in a position in a school or district level. So I wanted to share that with you. Thank you. This is an example of the practices specifically as I work and I coach at the school level as well to set up a framework, and every school has its own context. So I have to look at this school by school. However, there are certain practices that we are supporting from district in the schools. So this is an example of what it looks like just with the trauma-informed approach. One thing is we have a community resource map that we do in every school. We want to know who's in our school, supporting at each level from prevention through targeted interventions. And we want to refer to that. And then who do we have as community partners outside of the school? We want to align. So this is an example showing that this school, we have school-wide mindfulness practices. We have self-regulation spaces in the classroom. We really focus on mental health literacy. We want the students to know where to go and when to go for support, which is one piece of mental health literacy. It's important that they know that, and we set up that in the school. And then supporting our staff well-being is definitely a foundational piece to this framework. As we move up, we have self-regulation space and a plan for students that need that outside of the classroom, and then small group counseling that addresses trauma. And it's Bounce Back. If you're familiar or not familiar with that, that is a small group counseling program for trauma for elementary. CBITS is for secondary schools, and Strong is a trauma intervention for newcomers and refugees. And that again moves up through if there are individualized supports needed, they offer that as well. And then another intervention is Renew, which is person-centered planning for secondary schools. So this is an example of how we coordinate resources in a framework. If you are in a school or district and able to work on something like that, I wanted to give you access to a tool from trauma sensitive schools. There is again a link at the end to the entire training series, but several pages in there help walk you through, well, what could our framework look like? And if you go to the next slide, it walks you through, what do we have universally? Yep, we have this, we do this well, we'd like to improve upon this, or hey, this is something we want to do. So this would be an action planning tool for you and your team and stakeholders that you would gather together to work on what you would like to do from universal through targeted and intensive interventions. So whether you're at a district or school level, there's specific roles that you would need to take to support a framework. And one piece that I'm working on specifically in my district is really clarifying, aligning district policies that support trauma-informed schools and implementation. And really important, again, to break down silos is to look at any new initiatives that district or community leaders are proposing around trauma-informed practices in the schools, sitting at the table and talking about this, saying, is this something that our district needs or our schools need, and making sure that you're aligned and that we're all working together toward that one framework. And coordinating professional development and collaboration with community partners based on data, gaps, family feedback, and what the schools need. And if you're at the school level, it's very similar. You want to first review and implement any policies coming from district. If there are none, advocate with your stakeholders, your parents, that you what you would like to see at the district level around supporting a trauma-informed framework. If you have a school-wide team at the district level, you can plan systems and practices that support trauma-informed schools, like I just showed you, and use data to make decisions. What do we have? What do we need? What are we missing? And then the intervention team, again, making sure that you have appropriate interventions that students can be connected to get the supports they need in school. Again, collaborating and aligning with community partners is so important around this work, and identifying what you need based on what the data is telling you. Here are the resources that I referred to and showed you. I have links to a larger training that's for schools around understanding trauma and its impact, that Trauma Aware, first part of the trauma framework, and then building trauma-sensitive schools. So those will bring you into some wonderful resources, some documents for staff, some PowerPoint presentations. So I really like those resources and wanted to share those. And then the trauma responsive schools survey, which it looks like the link, I will have to update that there. But it is also in one of the slides. And then if you're looking for a deeper dive, the Philadelphia East Task Force document there. Thank you.
Thank you so much, Stacy, for that really wonderful and very complex view of engaging these stakeholders in the Manchester School District, which I know Stacy has worked really hard over the last couple of years to do and get everybody on board. And those of you doing that work know how challenging that is and how much time and patience that it takes. And so I hope that you'll check out some of those resources that Stacy linked to, because there's some really wonderful tools and very actionable, action-oriented guidance for you all as you're trying to build these coalitions of folks and champions to do this work. Because again, we've said many times throughout this series, we have to all work together to do this. This is not a one-person job or even the job of a team. It really takes everybody working together. And so to that end, I want to welcome Dana Asby to talk to us about engaging with families and using, leveraging those relationships and really building those collaborations to help support this work. Dana?
Thank you so much, Martha. I'm so excited to be here. In addition to having lived experience as someone who grew up in a household with both childhood and adult mental health and substance use challenges, as well as having that experience of working in public schools with some children experiencing childhood trauma and mental health challenges, and also being on the team with Martha, Ingrid, and Stacy to work on implementing these research and evidence-based practices around compassionate school culture. I'm here in a different role today now to represent the voices of families who have children across the lifespan of mental health and/or substance use challenges. So today we're going to talk about moving from this idea of family involvement, which many schools have gotten the hang of, to having really rich and high quality family engagement. So I'd like to start off today with a definition of family engagement that the National Federation of Families and the National School Mental Health Center came up with together. So family engagement is a collaborative and strengths-based process. So we're doing things together and focusing on what's working rather than just really getting bogged down with the problems that we can all kind of agree on already. So this process is one through which professionals, families, and children, all of those people Martha was just talking about, have to work together, build positive and goal-oriented relationships. So we want to really be focusing on where we all want to get to and get there together through the shared responsibility that families and school staff have at all levels. Anyone who's interacting with a child requires mutual respect. So what is that in terms of when we're thinking about families? At the National Federation, we believe that families' lived experience is expertise. We know that our school mental health providers and our educators go to school and they learn about really important supports that they can bring to each child, but we want to also make sure that we're honoring the experiences families have and making sure that when we are talking about mental health and substance use, we're not using jargon, we're not using acronyms, we're really using this language that families can understand or explaining anything that's necessary to them. We're going to want to try to make our language person-centered, not talking about what's wrong with the child, but the child as a person first. We want to make sure that when we're starting to engage with families, we're trying to make sure that we both have a similar understanding of the situation. And we as a school staff want to share as much information we have with the families as they can share at their own pace with us. We also want to make sure that when we're planning our meetings that we are really making these intentional. We're coming in with a goal and we're keeping our mindfulness and our presence there so that we can stay in the collaborative process, use respectful conversation, and in those instances that conflict does ensue, use positive conflict resolution skills. So with the National Center for School Mental Health, the National Federation did develop some principles of effective family engagement. So these include taking that shared responsibility that values an equal partnership. So really breaking down that idea of power and authority that we can sometimes get from a school mental health provider or an educator, and acknowledging that families can have an equal part to play in their children's mental health and substance use support. Again, using that genuine respect, thinking about all of the cultural and linguistic diversity of families. That might mean having translation services available, having materials printed in a family's home language. I heard both Martha and Stacy really hit home the importance of having relationships that are really centered around this shared goal. Thinking also of the children's development and learning alongside the whole family's well-being. We also want to keep in mind that children's mental health and substance use needs are not just in any one setting, but that they might be having challenges in early learning settings, at school, throughout their academic career, and in these transitions from school to home and home to school. And we want to think about continuity of supports across all of those settings. When we're thinking about effective family engagement, we know that that's going to require some professional development. Stacy mentioned some great programs that the whole school staff can use. I know that Ingrid and Martha have wonderful resources that can really get all of the staff, from the bus drivers, the administrators, the teachers, everyone in the building on that same page so that they can strengthen their relationships with families. We also want to make sure that we're giving opportunities in family engagement practices so that we can help families build their own capabilities and connections with each other. We also have to do a mindset shift where we're really seeing families as capable and competent partners, and we're treating them that way. Finally, the last principle here is that this can't just be a one and done family night. This can't just be enhancing the way that we're doing family meetings. We have to make sure this is systemically embedded not just in the education system, but what Stacy and Martha were both talking with the Heart Initiative and the work Stacy's doing in Manchester. We have to go outside the school building and bring in partnerships so that we're having this happen in the juvenile justice system. We're having this happen in the housing system. We're really looking beyond the school to build a coalition of support for these families. So a lot of schools have gotten this idea of how to involve families, but we want to move beyond involvement to true engagement. In involvement, we as a school are defining how families can be involved with our school. But when we engage with families by asking them how, when, and where they can be a part of the school, that engagement is going to be more sustainable and it's going to work better for both the families and the school. Many schools are assessing their school climate at the Heart Academy. You're using your school compassionate culture analytical tool for educators. That's so important to understand what our school climate looks like, where our areas of strength and growth are. But we want to make sure we're also asking families to assess that because they might be seeing some things that we're not seeing. And we have to go beyond just asking them what we need to change, but we actually need to make those improvements once they're identified. Family involvement might look like getting a small group of families together to better understand their needs in a focus group. Engagement goes a step further and takes all of those considerations you learned about and applying them to policies, program, and having planful engagement activities that meet those needs that they identified. Involvement might include gathering data for a demographic profile, so a questionnaire, and that engagement would take a step further and making sure that that demographic profile informs any decisions that we're making so that we can meet the needs of most families, or all families ideally. Family involvement would include establishing goals with families, making sure that you're bringing the family voice into that process. And engagement includes sharing the goals and working with families to accomplish, assess, and that third step, revise them. We don't just want to get to the evaluation point and stop. We want to make sure we're continually checking in with families, with school staff, with students themselves, if this is working. And if it's not, make changes. Family involvement includes raising awareness. So when you do know the needs, getting the word out, making sure you're using social media, emails, radio ads, newspaper, opinion pieces, every kind of channel you can to help families understand what they can do to help. Engagement takes it a step further and gets families and communities to spread the word through these families who are already engaged so that you have kind of a ripple effect of people who are involved in this support of children's mental health and behavioral health needs. It's helpful for school staff to understand the difference between barriers to involvement and engagement. We might not really think about the fact that families who aren't showing up at these activities or at the volunteer options that you have, the issue is not that they don't want to be involved. It might be that they just have so many different barriers to overcome. Their car broke down. They don't have money to catch the bus this month. Their childcare fell through for the day. They have to stay at work a little later last minute. They can't change their schedule for work. Bad weather means they're not going to be able to walk the 1.5 miles they usually do to get to the school building. When we're thinking about engagement and why families might not engage as sustainably, then we want to think about the beliefs that families might have about that stem often from their own experiences navigating the education, mental health, and/or substance use systems. They might have some fear and suspicion and distrust because of the way they have been treated, the discrimination that they have faced themselves. There might be some pride or cultural uniqueness around the way that mental health and substance use support is perceived in their own communities. They might feel unwelcome, disrespected, or overpowered, or have that power imbalance that we talked about with the authority of the education administrators and mental health providers, people with those letters after their name. That might feel really intimidating. Misunderstandings are so common. And then there might also be beliefs about the specific roles that families and teachers play and not really wanting to cross those boundaries that they perceive in their head. So at the National Federation of Families, we are an organization that supports family-run organizations. And family-run organizations train and employ family peer specialists. So family peer specialists are a really great way to bridge the gap between mental health providers and schools who are trying to engage with families. So at the National Federation of Family, we offer a family peer specialist certification. These are people, if you could go to the next slide, Martha. These are people who have lived experience as a primary caregiver, usually a parent, of a child with emotional, developmental, behavioral health, mental health, and/or substance use challenges. So to become a family peer specialist, you are typically already employed by a family-run organization, and you are offering peer support to other families of children experiencing these challenges. And while you're doing that, you're accruing 88 hours of training in our 5 family peer specialist core competency. Those include wellness and resiliency, affecting change, resources and natural supports, systems knowledge and navigation, and professional responsibilities. So while they're getting trained up to be able to help families navigate all of the challenges related to behavioral health and mental health, they're going to be doing 1,000 hours or more of either paid or volunteer family peer support work, working one-on-one with families. 20 or more of those hours do need to be supervised by someone at a family-run organization. After they've completed all of this, which typically takes about a year of full-time employment or longer, they have an application that's reviewed, and they are allowed to sit for the national certification exam. And there's more information about that on our website. So what do family peer specialists actually do in practice? How can they support families? One of the primary things that family peer specialists do is offer that peer support. So they listen and relate to families' concerns, challenges, and needs from a place of true understanding, which can be so powerful for families who have felt like they are doing this alone for so long. They also normalize mental health and substance use challenges as something that happens not because of any kind of moral failing, but because this is something that is a mental illness that can be coped with. Another thing that the peer support aspect of family peer specialists offer is to share in their challenges and successes as an individual and hear from the family themselves so that they can learn from each other. And then they also provide lots of resources to both help the family reduce discrimination, achieve that parity within mental health and healthcare, and to access services. There are so many systems that families of children with mental health and substance use challenges need to navigate. So family peer specialists can be alongside the families in each of those scenarios. They can often attend IEP meetings and help the family advocate for services because of their own experiences. They can also go with families to drive them to mental health and healthcare appointments. They can help them demystify some of those insurance practices so that they make sure they're not paying more out of pocket than they need to. If a child is involved in the juvenile justice system, they can prepare families for this experience and help them find representation if necessary. When families need housing, they can connect families to temporary housing and support the process of applying for more permanent housing. Finally, another important aspects of family peer specialist jobs is to teach families evidence-based strategies for their own self-care, because we know when families are navigating all of these systems, supporting a family member with challenges, it can be really difficult for them to avoid burnout and compassion fatigue themselves. And they also want to really think about the whole family's mental well-being. So offering specific self-care and community care strategies. I know Heart has a ton of those on resources. They also teach them conflict resolution skills. They give them specific strategies for specific mental health and substance use challenges. They can also connect them to providers and provide resources for crisis prevention and care. So at the National Federation of Families, we are running SAMHSA's first technical assistance center for families. It's called the National Family Support Technical Assistance Center. We offer free technical assistance to states, organizations, agencies, and families and individuals who are looking to support families. We have a resource library with tip sheets and lots of great resources for you. We also have both on-demand recorded trainings and live trainings that we do. We have 3 offerings for families. We bring families together to talk about a topic in our Family Connections events. Our webinars are informational and introduce innovative concepts around family peer support to the general population. And then we have office hours available to executive directors and emerging leaders of family-run organizations, where we talk about organizational practices and sustainability. And I just want to tease a little bit of what's coming soon. We're working with the New England MHTTC to do a tip sheet for families and educators to address the bully. We're also working on a family engagement checklist for clinicians. We'll be releasing a family support toolkit soon. And we are also going to be working on a family peer specialist training that will come out in the coming year. So please stay posted to our NAFSTAC website for all of that and more. And I'm going to pop some links in the chat for you.
Thank you so much, Dana. I mean, there's a wealth of information, as you can see, and I really appreciate the focus on the strengths and the lived experience of families and students in this work, and an opportunity to think more deeply about moving from involvement to engagement. And now I just want to remind everyone that at the end of this hour, we will have a half hour for office hours and opportunities to ask questions, get specific guidance from our speakers about more of their work and some of the things that you all are thinking about. So now I'm going to pass it to Ingrid.
Hey there, thanks, Martha. I just kind of like to key in from a communications and kind of strategy perspective on some of the things the other speakers have mentioned today. Having a shared vision that respects and includes the perspective of all community stakeholders is really the key to collaboration. Much to the annoyance of the people around me, probably, I say a lot, teamwork makes the dream work, you know. I know it's corny, but it's like a prompt. It really helps me to reflect on and remember the importance of connection. And I really mean it when I say it. Right now, our world is quite siloed. It's hard to build relationships. But everyone in your school community really needs to have a seat at the table. And when you're considering ways to build and sustain a compassionate school community, like that's compassion in action, right? Stakeholder engagement has, positive functions. It can be used to gather feedback from different perspectives. It can also help to guide a project's direction, but it can also really increase buy-in. And when stakeholders are committed to the success of the project, because they're engaged, not just involved. They're fully aware of the benefits of the program and what it's going to create for the community, then they're more willing to offer support. So I encourage you to identify champions. Of course, there are always naysayers. So hone in on the opportunities to connect with the people who get it and who really want to help you move your agenda forward. I also want to share, contrary to my background, which is Boston Commons, I live and work in the DC area. And so some people play the party game kind of 6 degrees of separation. I've done that as a fundraiser, trying to get to some big fish, But in DC, we also play how many phone calls are you away from the president? So use this tactic to consider your stakeholders, to map them by interest and influence. How many phone calls or emails are you away from city, state officials, presidents and CEOs of youth or family serving community-based organizations? Remember, access is power. I have a friend who just was a writer and wanted to try to get into the business, and she reached out to Tyler Perry and he answered her. So you never know what you can do, particularly when people are really, in this fast-paced world and really looking more at Twitter than anything else. Also, survey and engage your stakeholders. Take advantage of opportunities to gain that insight, and make sure you cast a wide net to ensure diversity at all levels. And then develop messaging that's, with your stakeholders, not for them. It's essential that stakeholders believe that their input is important and valued. And again, I just read somewhere that people really can only consume 27 words, and after that, you can stop talking. So try to craft messages, that either inform, promote, inspire, or activate. As we said today, you want to help people to kind of activate their power. Some people are more moved by descriptive messages with facts and data. Others are more moved by your aim or an inspiration, a desire for change. And then there are those, probably like me, who are driven to a call to action. Like, if you tell me what you need me to do, I'm there to do it. And that crowd is really a huge number that can help you move people forward. And then finally, measure the success of engagement. We're going to talk a little bit more about this in our next session. But, as Dana said, in terms of involvement versus engagement, you can focus on the numbers, right? How many people came to a meeting, how many people downloaded a fact sheet, but you really want to know the degree to which stakeholders feel like they're part of a positive community. They feel like their input matters. They're comfortable sharing their thoughts and opinions. And so with that, I will give us a moment to pause and have a Q&A opportunity facilitated by Martha. And I do hope that you can stay with us for our little office hours activity.
Thank you so much, Ingrid. I know we only have a couple minutes left in this hour. Again, please stay with us if you want to ask more questions. But for now, if anybody has questions, comments, suggestions, successes, you can raise your hand, unmute yourself, or write in the chat. I know we've given you a lot of information today, and one of the things that I hope that you take away as you're thinking of your questions is how, no matter where you're starting, you may be starting in a school or a community that is not familiar with any of these concepts, or you may be in a community that is already employing some of these ideas and some of the structures, say, that Stacy talked about, or that is aware of the family peer specialists. No matter where you're starting, you can start small to go big. You can change one thing, you can change a couple of things, and begin where you're at. A lot of the things that Stacy and Dana talked about were moving on a continuum, right? So no matter where you're starting on the continuum, there's always movement that you can help affect, even if it's just in your small corner of your school community or your larger community. So do we have any questions right now? Or maybe you're waiting until the office hours. So I'm going to ask Ingrid to tell us more about what is upcoming, and then I hope you'll stay with us.
So thank you for joining today's session. Make a note and join us for our final session, which is March 9th. And again, that's going to offer kind of concrete advocacy, fundraising, communications, and engagement strategies. We'll also provide talking points and infographics and other materials to help you convey the urgency of comprehensive school-based mental health supports. Becoming a Heart Ambassador is an opportunity to bring impactful programming to your school. You can also earn CE credits, connect with experts, build community, and learn about funding opportunities to support your on-the-ground efforts. We also invite you to check out school mental health resources from the broader MHTTC network, including the National School Mental Health Best Practices Implementation Guidance and Classroom Wise, which is an acronym for Wellbeing, Information, and Strategies for Educators. And we invite you to learn more about our course. The New England MHTTC's online course is called Cultivating Compassionate School Communities that Respond to Trauma Effectively. It's a 12-hour course that offers recommendations to cultivate a compassionate school community that buffers against the negative effects of trauma, builds resilience for all students, and provides stress relief and enhanced well-being for teachers and other school personnel. Again, our funding comes from SAMHSA, which requires us to evaluate our services. I just added a link to the survey in the chat. We appreciate your honest, anonymous feedback, which will provide information to SAMHSA and assist us in planning future meetings and programs. Your feedback counts. For more information, contact the New England MHTTC. For questions about our school mental health initiative, contact me or Martha at the emails listed in the packet, and connect with our experts as a part of our office hours today. Thank you and have a great day.